Section 5. Mood disorders. 1. Blank refers to a pervading feeling. A. Mental disorder. B. Mood. C. Affect. D. Anxiety. The correct answer is B. Mood. 2. Which of the following is a mood disorder? A. Bipolar disorder. B. Mental disorder. C. Schizophrenia. D. Dystonia. The correct answer is A. Bipolar disorder. 3. Blank refers to the outward expression of emotion attached to ideas. A. Mood. B. Affect. C. Anxiety. D. Schizophrenia. The correct answer is B. Affect. 4. Which of the following is known as a severe reduction in the intensity of outward emotional expression? A. Flat affect. B. Blunted affect. C. Restricted affect. D. None of the above. The correct answer is B. Blunted affect. 5. Blank is the reduction in the intensity of outward emotional expression. A. Inappropriate affect. B. Labile affect. C. Restricted affect. D. Flat affect. The correct answer is C. Restricted affect. 6. Which of the following is a rapid and easily changing affective expression unrelated to external events? A. Mood. B. Restricted affect. C. Flat affect. D. Labile affect. The correct answer is D. Labile affect. 7. Which of the following is a challenge faced when caring for a patient with mood disorders? A. Mood disorders may cause primarily somatic symptoms. B. Patient may neglect self-care. C. A depressed patient may be at risk of suicide. D. All of the above. The correct answer is D. All of the above. 8. Blank theory suggests that people who suffer from depression process information in a characteristically negative way. A. Cognitive theory. B. Behavioral theory. C. Restricted theory. D. Psychological theory. The correct answer is A. Cognitive therapy. 9. According to the blank theory, people with mood disorders believe that their negative perceptions will continue to the future. A. Psychoanalytic theory. B. Behavioral theory. C. Cognitive theory. D. Restricted theory. The correct answer is C. Cognitive theory. 10. Which of the following is true about behavioral theory? A. Depression results from negative events. B. Depression results from harsh superego. C. People with depression view themselves in a negative light. D. All of the above. The correct answer is A. Depression results from negative events. 11. There are blank theories that offer explanation for mood disorders. A2, B3, C4, D5. The correct answer is B3. 12. Which of the following disorders is also known as a manic depressive disorder? A. Major depressive disorder. B. Panic disorder. C. Anxiety disorder. D. Bipolar disorder. The correct answer is D. Bipolar disorder. 13. Blank disorder is marked by severe pathologic mood swings. A. Bipolar disorder. B. Affect. C. Major depressive disorder. D. None of the above. The correct answer is A. Bipolar disorder. 14. Which of the following is the extreme high of bipolar disorder? A. Depression. B. Mania. C. Range of emotional expression. D. All of the above. The correct answer is B. Mania. 15. An estimated blank people in the United States have bipolar disorder. A. 1 million. B. 2 million. C. 3 million. D. 4 million. The correct answer is C. 3 million. 16. Which of the following is not true about bipolar disorder? A. Women are more affected than men. B. Women are likely to have more depressive episodes. C. Men experience more manic episodes. D. Men and women are affected equally. The correct answer is D. Men and women are affected equally. A. Women are more affected than men. 17. Onset usually occurs between the ages of blank. A. 15 and 25. B. 20 and 30. C. 25 and 35. D. 30 and 40. The correct answer is B. 20 and 30. 18. Mania is characterized by which of the following? A. Euphoria. B. Elation. C. Decreased sleep. D. All of the above. The correct answer is D. All of the above. 19. All of the following is true about patients with bipolar disorder, except A. Impulsive behavior of manic episode may have far-reaching consequences like child abuse. B. They never experience psychotic symptoms. C. They have increased incidence of sexually transmitted disease. D. Some patients have rapidly alternating moods. The correct answer is B. They never experience psychotic symptoms. 20. Bipolar disorder occurs in blank major types: A2, B3, C4, D5. The correct answer is B3. 21. In blank, the patient doesn't experience severe mania, but instead has milder episodes of hypomania that alternate with depressive episodes. A. Bipolar 1 disorder. B. Bipolar 2 disorder. C. Bipolar 3 disorder. D. Bipolar 4 disorder. The correct answer is B. Bipolar 2 disorder. 22. In blank, the patient has a history of numerous hypomania episodes intermingled with numerous depressive episodes that don't meet the criteria for major depressive episodes. A. Bipolar 4 disorder. B. Bipolar 2 disorder. C. Cyclothymic disorder. D. Bipolar 1 disorder. The correct answer is C. Cyclothymic disorder. 23. For someone with blank, mood swings comes fast. A. Rapid cycling bipolar disorder. B. Cyclothymic disorder. C. Bipolar 2 disorder. D. Bipolar 4 disorder. The correct answer is A. Rapid cycling bipolar disorder. 24. Which of the following is a symptom of bipolar disorder in the manic phase? A. Low self-esteem. B. Social withdrawal. C. Overwhelming inertia. D. Impulsivity. The correct answer is D. Impulsivity. 25. During a depressive episode, the patient may report which of the following symptoms? A. Short attention span. B. Impaired judgment. C. Social withdrawal. D. Increased psychomotor activity. The correct answer is C. Social withdrawal. 26. Treatment of bipolar requires which of the following therapy? A. Psychotherapy. B. Electroconvulsive therapy. D. Drug therapy. D. All of the above. The correct answer is C. Drug therapy. 27. Which of the following drugs isn't approved by the Food and Drug Administration for the treatment of bipolar disorder? A. Lithium. B. Depakote. C. Valproic acid. D. Carbamazepine. The correct answer is D. Carbamazepine. 28. Which of the following is not true about the drug lithium? A. It has a narrow margin of safety and can easily cause toxicity. B. It should be used if the patients can't have regular blood tests. C. Treatment with lithium should begin with a low dose. D. Blood level should be checked after 8 to 12 hours after first dose. The correct answer is B. It should be used if the patients can't have regular blood tests. 29. Which of the following is an appropriate nursing intervention for a patient with bipolar disorder? A. Involve patients in activities that require gross motor movement. B. Institute suicide precautions as dictated by the facility policy. C. Anticipate the need for excessive verbalization. D. All of the above. The correct answer is D. All of the above. 30. In blank, short periods of mild depression alternate with short periods of hypomania. A. Cyclothymic disorder. B. Major depressive disorder. C. Dysthymic disorder. D. Mood disorder. The correct answer is A. Cyclothymic disorder. 31. Which of the following is true about cyclothymic disorders? A. It affects up to 3% of the population. B. It strikes more men than women. C. Typically, onset occurs in the teens or early 20s. D. All of the above. The correct answer is C. Typically, onset occurs in the teens or early 20s. 32. Which of the following is a symptom of cyclothymia during the hypomanic phase? A. Insomnia. B. Crying. C. Lethargy. D. All of the above. The correct answer is A. Insomnia. 33. Which of the following is not true about cyclothymic disorders? A. Hypomanic periods may enhance a person's achievement in business. B. Hypomanic periods may damage social relationships. C. Approximately 80% of patients experience a full-blown manic episode or major depression. D. Many cyclothymic disorders patients self-medicate with alcohol. The correct answer is C. Approximately 80% of patients experience a full-blown manic episode or major depression. 34. Which of the following is a symptom of cyclothymic disorders during the depressive phase? A. Rapid speech. B. Inflated self-esteem. C. Increased productivity. D. Loss of libido. The correct answer is D. Loss of libido. 35. Which of the following is the most likely cause of cyclothymic disorders? A. Genetic factors. B. Biological factors. C. Psychological factors. D. All of the above. The correct answer is A. Genetic factors. 36. Which of the following medical disorders can mimic cyclothymic disorders? A. Stroke. B. Trauma. C. Uremia. D. All of the above. The correct answer is D. All of the above. 37. To be diagnosed with cyclothymia, the patient must experience numerous periods with hypomanic symptoms for at least blank. A. 1 month. B. 6 months. C. 12 months. D. 24 months. The correct answer is D. 24 months. 38. Psychiatric disorders that can mimic cyclothymic disorder include which of the following? A. Mood disorder. B. Bipolar 1 with rapid cycling. C. Borderline personality disorder. D. All of the above. The correct answer is D. All of the above. 39. Which of the following is a pharmacologic treatment option for cyclothymic disorder? A. Calan. B. Valproic acid. C. Tegretol. D. All of the above. The correct answer is D. All of the above. 40. Blank is a persistent sad mood lasting 2 weeks or longer. A. Persistent depression. B. Major depressive disorder. C. Borderline personality disorder. D. Bipolar 2. The correct answer is B. Major depressive disorder. 41. Which of the following is true about unipolar major depression? A. It often goes undiagnosed. B. It shares some symptoms with hypomania. C. Those who have it commonly receive adequate treatment. D. None of the above. The correct answer is A. It often goes undiagnosed. 42. About blank of women in the United States experience major depressive disorder at some point in their lives. A. 2%, B. 20%, C. 22%, D. 25%. The correct answer is C. 22%. 43. About blank of men in the United States experience major depressive disorder at some point in their lives. A. 6%, B. 16%, C. 20%, D. 25%. The correct answer is B. 16%. 44. About 50% of patients affected had their first episode of depression at about age blank. A. 10, B. 20, C. 40, D. 70. The correct answer is C. 40. 45. Which of the following can be a factor that causes depression? A. Genetic factors. B. Psychological factors. C. Social factor. D. All of the above. The correct answer is D. All of the above. 46. Secondary depression can result from which of the following? A. Cancer. B. Anemia. C. Lupus. D. All of the above. The correct answer is D. All of the above. 47. Which of the following is an organic cause of major depression? A. Steroids. B. Anemia. C. Cimetidine. D. Psychotropics. The correct answer is B. Anemia. 48. Which of the following factors can predispose a patient to suicide? A. Substance abuse. B. Thinking is distorted. C. Family abuse. D. All of the above. The correct answer is D. All of the above. 49. Which of the following tests can be used to determine a drug-induced depression? A. Toxicology test. B. Beck Depression Inventory. C. Dexamethasone test. D. All of the above. The correct answer is A. Toxicology test. 50. Which of the following tests can be used to determine symptoms onset, severity, duration, and progression? A. Toxicology test. B. Beck Depression Inventory. C. Dexamethasone test. D. All of the above. The correct answer is B. Beck Depression Inventory. 51. Which of the following is the most effective method of treating depression? A. Pharmacologic therapy. B. Electroconvulsive therapy. C. Psychotherapy. D. All of the above. The correct answer is A. Pharmacologic therapy. 52. Blank has become the first choice of treatment for most patients. A. Serotonin norepinephrine reuptake inhibitors. B. Atypical antidepressants. C. Selective serotonin reuptake inhibitors. D. Elavil. The correct answer is C. Selective serotonin reuptake inhibitors. 53. Which of the following treatment lacks most of the disturbing adverse effects associated with TCAs, tricyclic antidepressants? A. Atypical antidepressants. B. Serotonin norepinephrine reuptake inhibitors. C. Selective serotonin reuptake inhibitors. D. Monoamine oxidase inhibitors. The correct answer is C. Selective serotonin reuptake inhibitors. 54. Which of the following is rarely used today as treatment for patients with major depressive disorder? A. Serotonin norepinephrine reuptake inhibitors. B. Monoamine oxidase inhibitors. C. Atypical antidepressants. D. Tricyclic antidepressants. The correct answer is B. Monoamine oxidase inhibitors. 55. Which of the following is an example of monoamine oxidase inhibitors? A. Ascendi. B. Nardil. C. Pamelor. D. Sermontil. The correct answer is B. Nardil. 56. Blank is used to treat severe depression when psychotherapy and medication aren't effective. A. Electroconvulsive therapy. B. Pharmacologic therapy. C. Psychosocial treatment. D. Rehabilitation. The correct answer is A. Electroconvulsive therapy. 57. Patients who have been administered Divalproex should be instructed blank. A. To use a reliable form of birth control. B. Not to crush tablets. C. To eat sugarless gum. D. To wait 5 weeks after stopping the treatment before starting MAOI. The correct answer is B. Not to crush tablets. 58. The patient should fast for blank before electroconvulsive therapy. A. 2 to 4 hours. B. 3 to 5 hours. C. 4 to 5 hours. D. 6 to 8 hours. The correct answer is D. 6 to 8 hours. 59. In a typical electroconvulsive therapy treatment, the patient receives blank treatments a week. A. 1 to 2. B. 2 to 3. C. 3 to 4. D. 4 to 5. The correct answer is B. 2 to 3. 60. Which of the following is a contraindication to the use of the electroconvulsive therapy treatment? A. Myocardial infarction. B. A history of stroke. C. Intracranial lesions. D. All of the above. The correct answer is D. All of the above. 61. Which of the following is a contraindication to the use of Divalproex? A. Liver disease. B. Early pregnancy. C. Renal disease. D. Hepatic disease. The correct answer is A. Liver disease. 62. Which of the following nursing interventions may be appropriate for a patient with major depression? A. Assume an active role in initiating communication. B. Be aware that the suicide risk rises as the depression lifts. C. Plan activities for times when patient's energy level peaks. D. All of the above. The correct answer is D. All of the above. 63. Which of the following is a sign of a potential suicide patient? A. Hoarding medications. B. Putting affairs in order. C. Talking about death. D. All of the above. The correct answer is D. All of the above. 64. If a patient is taking monoamine oxidase inhibitors, which of the following should be avoided? A. Chianti. B. Pickled herring. C. Caffeine. D. Yeast extract. The correct answer is C, caffeine. 65. For patients taking monoamine oxidase inhibitors, food containing tyramine should be avoided because it can cause blank. A, galactorrhea. B, vertigo. C, hypertension. D, all of the above. The correct answer is C, hypertension. 66. Blank refers to mild depression that lasts at least 2 years in adults. A, dysthymic disorder. B, major depression disorder. C, bipolar disorder. D, acute depression disorder. The correct answer is A, dysthymic disorder. 67. Dysthymic disorder affects up to blank of the population. A, 1%, B, 3%, C, 15%, D, 30%. The correct answer is B, 3%. 68. Which of the following is true about dysthymic disorder? A, an estimated 10% of patients with dysthymic disorder have a coexisting psychiatric disorder. B, it has mild symptoms. C, it is easy to treat. D, symptoms can be easily identified. The correct answer is B, it has mild symptoms. 69. All of the following are symptoms of dysthymic disorder except A, reduced energy level. B, poor concentration. C, rapid speech with frequent topics. D, inability to make decisions. The correct answer is C, rapid speech with frequent topics. 70. Blank may be used to re-educate the patient's social skills and help him make attitude changes. A, pharmacologic therapy. B, psychotherapy. C, sociotherapy. D, behavioral therapy. The correct answer is D, behavioral therapy. 71. Which of the following nursing interventions is appropriate for a patient with dysthymic disorder? A, encourage positive health habits. B, encourage activities that enhance sense of accomplishment. C, provide reassurance to patient even if he becomes hostile. D, all of the above. The correct answer is D, all of the above.